Hello, I am Nicole Rissick from the Department of Health and Human Services of Office of Inspector General. Our mission is to protect the integrity of HHS programs and the health and welfare of their beneficiaries. I'm pleased to speak with you today about OIG's recent studies related to management, prescribing, and dispensing of opioids to patients receiving care from IHS-run pharmacies, hospitals, and tribal health clinics. While requirements may differ between IHS hospitals or pharmacies and tribal facilities, the findings and recommendations in our studies may help improve your facilities, services, and protect beneficiaries in your own communities. Let's start with a review of what we recently learned about opioid prescribing and monitoring practices in IHS. Although patients may receive opioids for legitimate reasons, any high amount raises concerns, with greater risk of abuse, misuse, and related health concerns. In our most recent work, we analyzed opioid prescriptions from IHS-run pharmacies between May 2018 and April 2019 to check for a high amount of opioids. On a positive note, we found that less than half of 1% of IHS patients who received opioids from IHS-run pharmacies received high amounts of opioids. We also learned that IHS has taken several steps to ensure appropriate opioid use among its patients. Since 2016, IHS has required providers to check state-run prescription drug monitoring programs, or PDMPs, that track patients' opioid prescriptions both within and outside of IHS. Checking these systems gives a more complete picture of each patient's medication. While we have identified problems with access and searching these systems, we encourage you to follow the IHS guidance and check these systems for every patient to whom you consider prescribing opioids. If your tribal facilities are not participating in the state-run prescription drug monitoring programs, please consider working to implement that practice. Second, IHS has adopted CDC's Guideline for prescribing opioids for chronic pain. We've included this guidance in the resource section of the video. We encourage you to review the guideline and apply it in your everyday practice. Third, IHS requires prescribers to take a training course on pain and addiction. In the resources section of this video, we provide a link to this IHS training. If you haven't already, please take time today to take this course. A more complete list of IHS's recent actions is provided in the video resource section. For more information on IHS progress in the fight against opioids, also see our companion video, IHS's efforts to combat the opioid epidemic. In 2018, audits of 2 tribal health clinics' compliance with health and safety requirements, one for 2014 through 2016 and the other for 2015 to 2018, we found that one clinic lacked written policies and procedures for opioid prescribing and compliance monitoring, and the other clinic's written policies were inadequate. We discovered that not all patients receiving opioids had signed controlled substance agreements to comply with their opioid treatment plans. The lack of adequate written policies and procedures resulted in insufficient guidance for day-to-day patient care and inconsistencies in opioid prescribing and compliance. We recommended that the clinics develop, approve, and implement written medical policies and procedures that include pain management treatment, prioritization requirements for opioid prescribing, and compliance monitoring. In other work, examining 5 IHS hospitals' opioid prescribing and dispensing practices between 2013 and 2017, OIG found that they did not always follow the requirements regarding the prescribing and dispensing of opioids in all IHS facilities. Compliance with these requirements is key and helps improve appropriate pain management, identify patients struggling with opioids, and prevent diversion of opioids to illegal or improper use. I'll highlight several specific requirements that these hospitals didn't consistently follow and make suggestions for what you might do to help. First, IHS hospitals didn't always review the course of patient treatment at least every 3 months after opioids were prescribed. Not doing so can result in both overtreatment and undertreatment. We encourage you to regularly, at least every 3 months, review the course of treatment for any patient's prescribed opioids. We also found IHS hospitals did not always perform required urine drug screenings at recommended time intervals, including both scheduled and unscheduled screenings. We also found uneven follow-up with results and recommended revisions to the Indian Health Manual to provide better guidance for both follow-up and documentation. We suggest you review and follow the recommended time intervals for drug screenings, and once performed, consistently follow up with your patients on the results, documenting all actions. Third, IHS hospitals did not always maintain appropriate pain management documentation. Without this documentation, there is no guarantee that a patient has provided informed consent or has been properly educated on his or her responsibilities, risks, benefits, and alternatives for pain management. We suggest you ensure that you have educated your patients on these issues and that you maintain documentation of these interactions. Additionally, we recommended that IHS hospitals store opioids safely in appropriate secure containers to prevent unauthorized access. Other IHS facilities must also comply with IHS requirements, which align with requirements from the Drug Enforcement Administration. Tribal facilities are also required to store controlled substances appropriately in accordance with DEA requirements. A recent criminal case highlights the importance of safely securing opioids. In this case, an IHS patient pleaded guilty to entering an IHS clinic during nighttime hours, damaging the clinic, stealing hydrocodone, and then attempting to sell the pill to others. More securely stored opioids might have prevented this. Before we close, I want to emphasize the importance of compliance to opioid-related policies, procedures, and guidelines such as the Indian Health Manual, the CDC's Guideline for Prescribing Opioids for Chronic Pain, and the federal and tribal requirements for opioid prescribing and compliance monitoring. Of course, only IHS facilities are required to follow the Indian Health Manual. Tribal and urban Indian facilities follow their own guidelines. Other helpful information can be found at Safe Opioid Prescribing, which is on the hhs.gov website, which provides a compendium of resources to promote the responsible and effective use of opioids in treating pain, including clinical guidance for selected common acute pain conditions, pediatric pain management options, and links to continuing medical education courses, or CMEs, to help medical professionals maintain competence in opioid prescribing. Regardless of the specific opioid policies and procedures in place for your organization, compliance is key. What can you do to ensure compliance? We suggest wide dissemination of the policies, procedures, and requirements to prescribing clinicians, pharmacy staff, and other appropriate personnel. We encourage you to regularly review and update these to make sure they are current and relevant. We encourage you, as providers, to thoroughly review these to ensure you are compliant in your day-to-day practices. We also suggest internal training programs and other actions to continually reinforce the guidelines. As with the IHS required training course on pain and addiction, we encourage you to take all related trainings. Addressing the opioid epidemic is a top priority for OIG, and we hope our suggestions, based on our studies, will help you contribute to quality of care and service to all in need.